place for your experience and understanding on what you're going through, but your stories have resonated with me personally, as well as the team, which has driven us, one, in our, most importantly, in our advocacy to make sure you get the direct financial resources as well as employees that you need to help you get to the other side of this thing. And we pray that'll be sooner rather than later. So again, thank you. And thank you for all your input, all your suggestions and ideas. We factor all that in, especially your experience, as we determine policy moving forward. But we do so with the ultimate goal of keeping everyone healthy and safe and alive. So I am going to just give you a brief sort of a situational update, and then we'll get into some conversations. If you could bear with me 1 second. I will get this up, Sue, 1 second on my side. I apologize. Sue, why don't you take, yeah, when we go right through the slides, go ahead. First slide. So again, I know you've seen a lot of the slides. If you haven't, it's always important to understand the context and the lens by which we look at things every day, and that's in the numbers and data. And we have a really robust analytical team, and a lot of this should be of no surprise to you. The global trends of COVID are still moving at high velocity in the wrong direction. Although there's some different trends in different states and communities, but this snapshot of what's happening around the world should be of no surprise. It's information that's made publicly. We can see COVID is certainly just compounding as a worldwide pandemic. Next slide, please. The trends in the U.S., again, this is reported. We're hitting really historic and tragic milestones from, especially on total deaths, and we're well over 420,000 deaths at this time and climbing. The sobering reality is that people who die as a result of COVID always trails the cases. And what's really tragic, and I'd submit, is a lot of this could have been avoided. But here's a snapshot of where we are at that. We are grateful, however, we do have a federal administration and President Biden who's going to leverage science and expertise and set bold thresholds to actually have a national policy in the United States to take on COVID and beat this thing down. Next slide, please. Again, no surprise, daily new cases by state. COVID is still extremely prevalent. We are still in much of the country is in the red zone. That's more than 25 daily cases of states per per 100,000 averaging, and Massachusetts, almost all the Northeast New England, with the exception of Vermont, is still strongly in that category. Next slide, please. This is from the state's data website. Maybe you've seen it, if not, but the link is below if you want to dig into it more. We are now, we are now in the yellow. We had been recently in the red, again, which is less than or equal than 25 cases per day, based on our population size. This is per over the last 14 days, and this is as of January 28th, so from a few days ago. Current numbers will show we don't see that going in the wrong direction at the present moment. Next slide, please. Again, this is just information. You can just to let you know, the state has updated and changed their dashboard of indicators they're looking at. I'd invite you to take a look at that. We do look at that fact that, again, against all the numbers we're analyzing on a day-to-day basis, either to corroborate, just probe on their data and their assumptions, and to help us formulate our approach. Next slide, please. Again, just on their dashboard, the indicators they're looking at from hospitalizations and cases, testing and deaths. And you can see the correlation of different trends from where we were last, almost a year ago, to where we are now. Next slide, please. This is on the confirmed cases and the daily changes. The total confirmed cases, now we're approaching approximately 500,000 in Massachusetts, probably well above that. That's what we know of, what's confirmed. The deaths, sadly, we are now over 14,000 residents of the Commonwealth that we know of that have died as a result of COVID. Next slide, please. On the percent positive by date, again, through January 28th, this is for both, all of Massachusetts with higher education institutions and just higher education institutions on their own. We're, strong call, we're a robust college communities, and that has an impact, but it's important to distinguish between the two and the trends. and sort of mirrors what you've seen overall in the most recent resurgence coming from the fall for the winter and its peaks and what the current trends are now. Next slide, please. Hospital admissions. This is an important statistic. I invite you to look at it. I would say one of my concerns in leading with the statistic that the state has, it's important to know what our hospital system is in terms of its capacity. We did an incredible job, and I credit the governor and the administration and everyone in the Commonwealth at the beginning, especially municipalities, to doing what we had to do to make sure our hospital system didn't break down. And we've seen the consequences and the disaster of that, especially in Northern Italy, which is one of the best healthcare systems in Europe, when life and death decisions and really moral decisions are being made in the hallways of hospital wards and who to treat based on age and so forth. We've been able to maintain that, but my concern in this one metric alone, it's important to know where we're at. But just allowing things to happen as long as you have capacity only means you're giving people a hospital bed or an ICU bed and perhaps a ventilator if they need it. It doesn't prevent the greatest amount of death that we can prevent because it still relies on just allowing things to happen as long as we have capacity to treat people. That means more people are getting sick, inevitably higher, more serious case of illness as a result of COVID, and inevitably more death than needs to occur, than should have occurred, I should say. Next slide, please. This is just a snapshot, and some of you have had questions in terms of testing. You can see our data here. We are really just, we're robust testing. Fortunately, we've been able to ramp that up and lead in the region just behind Cambridge. And this is through January 23rd, and we've now conducted, at that time, we're probably over 21,000 tests to date. So testing is occurring and has been steadily increasing. And that's been very important to understand, to get some understanding of how the pandemic is evolving. Next slide, please. As a regional percent positivity rate as of January 28th, we were at 2.4% of COVID tests completed by some residents over the last 2 weeks had positive results. So we're at a 2.4% positivity. That's important. That's a good trend because it's down from 4.3% where it was 2 weeks prior. This statistic, by the way, only because I mentioned it in the states where they broke it out, we don't have it broken out. This statistic includes higher education, so students at Tufts University. And so you can see where we're at, and we like that trend. We want to see it be sustained. Next slide, please. In terms of the number of summable cases, positive cases identified through the state website that gets reported back to, you can see the most recent resurgence. Put my glasses on. I believe at our highest point, we hit over 80 cases in a day. Compared to where we were at the original surge. Remember, we were talking about flattening out the curve. And, if you recall back when we were entering the fall, local leaders like myself were hearing the words and advice, heeding the advice of other experts about needing to take measures to avoid the resurgence. I would say the Commonwealth's patchwork approach to avoiding transmission did not fare well. And you can see the resurgence that was predictable has done quite a number on us in a negative way. The number of positive cases here through the 28th in terms of fatality, sadly, I believe that number is now 60 or over because I got word of another one yesterday. And that's important. Remember, there are beloved members of every community in our Commonwealth and across the country who are dying and have died. And if any of you are connected to someone you know or someone in your family, someone you love who's passed away as a result of COVID, our hearts go out to you. But it's important to remember there's a human impact behind this. Next slide, please. On vaccines, I'm going to be brief on this. There's been a lot of news, and I'm sure some of you will have questions. This is from the state's website in terms of who is described in each phase as a priority. This is totally within the control of the Commonwealth of Massachusetts. I will say the state's rollout of the vaccine has been theirs and theirs alone. It did not factor in or consult or communicate or collaborate with any municipalities in our capacity at the local level through our local boards of health to administer vaccine based on our experience with flu vaccination and our emergency preparedness plan. I speak on behalf of hundreds of local officials, municipal elected leaders, city and town managers, and local boards of health leaders that we have advocated and implored the Commonwealth to use us as a resource and knowledge because we know our communities best, our neighborhoods best, our residents best, the people who are most vulnerable know how to do it. To date, you can see, you've heard the governor's announcements recently. They're basically launching sites that are places you go for mass vaccination. There are a lot of gaps and problems with that. We're hoping to try to right that ship with them. I'll go into more of that into detail with questions, but I just want to give you a snapshot on that update and where we're at. I will say this, the issue around supply of vaccine is at the federal level. It's not the states cause of that. However, again, we have our administration, President Biden, who is taking the bull by the horns and setting bold thresholds. Eventually, the necessary and needed allotment of vaccination supply will come. The challenge for all of us is to be coordinated, collaborating, and in sync with one another, so we give the vaccine a chance to succeed. And we'll talk about that in our Q&A. Next slide, please. In terms of business reopening, as you know, we made an announcement in terms of what businesses and activities are eligible to reopen February 1st. It's spelled out here. My staff is here to go over any questions. I'm sure, and I heard from many of you who I know or just reached out and said there's still inconsistency between what Somerville does or another city does or the state. You are spot on. The state's approach all along, whether it's been how do we initially close down activities to flatten out the curve a year ago, how we think about reopening and how to roll back or scale up, or how can we possibly open schools and school districts are now in vaccination, always has been patchwork and never had at the table municipal leaders who can help coordinate that so we have consistency and we have the greatest probability of success of not only beating the pandemic, but controlling the resurgence without an impact in terms of serious illness or loss of life, and as a natural consequence to people's livelihoods. Next slide, please. Again, there is, as you know, we're in the midst of round 3 of COVID small business relief. If you recall from our previous meeting, we've been, we're grateful and thankful to the governor that he responded to our request of stepping up from the state, not waiting for the federal government. I'm hoping there's going to be more there. We all are, and that the current proposal from President Biden passes. But we have been stressing for many weeks, if not months, the need for direct financial aid to small businesses and their employees, as well as individuals, to make them whole. And I say that with this context. It's been too much of, people being pitted against each other, whether it's understandably parents of school children upset that their kids can't go to school, the governor fighting with the teachers union, or businesses, understandably, and having valid questions about whether or not your needs and challenges are being addressed. And I'm at least somewhat gratified that they're listening a bit on this, that we're trying to fight the pandemic, not each other, but we need to make people whole who are undoubtedly and certainly impacted by necessary policy decisions to keep people healthy and safe. Next slide, please. I'm going to stop there. I just wanted to frame the conversation in terms of where we are without going too far. I know you're paying attention to this and talk about the context of where we are now, what may happen. I will say there are a lot of unknowns. We don't know what impacts the variants of COVID will have. And there is a sense of urgency. And I'll end with this before we take questions. We need to give the vaccine a chance. That means a few things. We certainly need to get more vaccine allotments and supplies and get it out and everybody vaccinated as quick as possible. We also need to keep transmission low. The vaccine, no matter how it reacts to certain variants, will only be effective, will only reap its greatest benefit effects and impacts if transmission is low. And that is the sense of urgency in the window that health experts are advising municipal and government leaders to act with. So with that, I know you have a lot of questions. I look forward to the conversations. I thank you for being here. And yeah, I'm all ears. And I believe, Sue, you're going to facilitate the questions and conversations, and we'll go from there.
Thank you, Mayor. I don't see too many questions on the Q&A. And again, folks, feel free to just go ahead and use the raise hand function and I can unmute you if you want to speak verbally. We have a general question about announcing recipients of the small business grants and sort of receiving replies from us. We are continuing to receive applications. We are reviewing them. If you got the submission confirmation, trust that we will reach out to you if we have any questions or if there's any missing documents. It doesn't automatically kick you out. So we will certainly reach out to you, and our hope is to get through them in the next couple of weeks.
Yeah, I do want to say on that point, and thank you for the general question. In terms of we'll hope we're going to see what happens with the federal government. We need to know continuously as we work together what else small businesses need. We know certainly direct financial support. We need to start engaging, and we're already thinking about, and I'll just use the example of small businesses. What is the future of Main Street? You know, how do we reignite and capture the wins we had at our sales in terms of our local economy moving forward? We're going to get to the other side of this thing, and we need to have that very engaged and robust dialogue.
There is a question from Adam Portney. There is a connection between opening schools and the ability to open and staff local businesses. Arlington, who we share a border with, just moved to open fully in the fall, while Somerville will not commit to being open at all in the fall. Will the mayor follow the president's mandate and Arlington's lead by committing to allowing all elementary school children back into a hybrid model by the end of this year and fully open all elementary schools by the fall?
Yeah, thank you for the question, Adam, and I appreciate it. I know you sent me an email too, so I will follow up with you and give you a ring as well. But for everyone, I just want to, let me frame my conversation this way on my response. I'm a parent of 2 children in Somerville Public Schools, and I want them more in school more than anyone else. We have developed a plan in Somerville where we're investing more than $7 million to upgrade our air filtration and handling systems, air handling systems, HVAC systems in all our schools. And we were the first, along with Medford, to partner with Tufts University to launch an innovative pool testing surveillance program for COVID in our schools. Those 2 things, we believe, help us carve a path through the pandemic. So notwithstanding what's happening around us, we can confidently say we have the ability to monitor real time how the pandemic is evolving within our school buildings, with our teachers, our staff, our students. Teachers and staff will be tested twice a week, students once a week. That being said, when schools are open, we'll have the ability to achieve our ultimate goal is to have them remain open. What we see around other communities is sort of this whack-a-mole approach. And this is a consequence, and I'm going to say it over and over again, of having a patchwork approach. It's great that everyone at the state level, the governor and DESE, the Department of Early and Secondary Education, say, yeah, you should be, it's safe to go in schools and so forth. Well, the reality is there are cases in transmission of teachers and kids, hundreds in the Commonwealth happening every week. The Commonwealth really doesn't have a grasp on it because they hadn't been testing the asymptomatic members of our school community. We need to do this together. We need the tools, and even President Biden and Vice President Harris campaign on this and are committed to giving municipal leaders and school districts the tools to do that. We believe we have them already in Somerville. We're working to implement that. And then the other part of this is we are working in conjunction with on the collective bargaining side with our teachers union. They're a necessary partner in this to get them. They need to feel safe, genuinely. We need to show them that they are and coming back. That is a valid concern. So I don't want this to be seen as a battle between municipal or school leaders and teachers or families. We need to get our kids back. And it's up to us as policymakers. We have a plan here to make sure we have a plan that is not only safe, but that allows schools to open up safely and sustainably remain open. Disruptions in school opening and closing are as bad as businesses opening and closing, and families need that predictability. I also want to say there are the haves and have-nots in some of, like many cities. The school children and family that are getting crushed the most in COVID, they're in certain neighborhoods. And if you did an overlay of environmental justice zones, subsidizing public housing, those are the families, Black, brown, immigrant, who are getting crushed. I believe we're going to get there. I'm committed personally to put everything I need to do in the city to get our kids back full time in the fall. But we got to deliver. We got to give them the support. And if, as frustrated as people from the business side are, and you have a valid point about this is a whole patchwork, inconsistent approach, how every city does it in the region. The same thing applies with schools and what we're hearing from teachers and staff, because the state really just pushed it off and was happy with having 351 cities and towns and school districts do it on their own. We got a plan. It will work. We are having positive, constructive conversation with the teachers union. The buildings aren't ready yet. They will be ready as we projected in that project timeline. And we're hoping to get everybody on board so that we can launch now. We want to get everyone back in the school in the fall. We'll have more to come on that. And I couldn't agree more. If you want to, we said this to the governor and others, if you really want to kickstart our economy, you got to give us the tools to open up schools so parents can get back to work. Long-winded answer, but that's the important context and logic behind it. Sue, we can't hear you. You're muted.
My apologies. Stephen Mackey, Chamber President, would like to say something. Stephen, I'm going to mute you. I'm trying to. Go ahead, Stephen.
Thank you, Sue. Thank you very much, Mayor and Tom. First of all, I'd like to say that we look forward, Mayor, to your leadership when the day comes that we're moving toward restoring Somerville's place in the region economically and socially and so forth. You've been an exceptional leader for quite a long time. I'd also like to say that, you know, you don't really get to know people for better or worse. I love your staff. There's been, you surrounded yourself with extraordinary individuals and a great team. But the rest is a little more difficult to say. You will characterize, when we talk about places outside of Somerville, immediately words like patchwork and whack-a-mole come into use. What I'd like to offer is a different perspective, is Somerville stands alone. And the pattern is that Somerville adapts the way the state does, but a week, depending on the industry, a week to 3 months after the state does it. So it raises the question, since we can walk across the street and be in another municipality, raises the question as to what we see differently here in Somerville than the rest of the world and the rest of the state. It raises the question as to how is Somerville more qualified than places with larger resources? I mean, we don't have a lot of people with advanced degrees in science that are on the city payroll or under contract to the city. We don't have a lot of people that are regularly employed that have advanced degrees in public health, okay? But Boston does, certainly the state of Massachusetts does, and we don't understand how the science that we all share and the data that we all share is somehow different here in Somerville. When everybody else seems to be moving in another direction, it's not that we don't, it's that it takes us a week to 12 weeks to do it. Now, I have had communications with the staff who I worked with pre-pandemic and in the pandemic. And I can show you a series of emails and texts where I asked the most simple questions. And I have never gotten a written response to clarify. I'll give you an example. If you go to your website, it says that restaurants can, right now, it says restaurant, you know, where it's about the phase 3, the most recent release. And it says restaurants can stay open for outdoor dining until 11:30 p.m. Depending on which staff member I talk to, it really means it's still 9:30, or no, it's indoor and outdoor until 11:30 p.m., or it's 1 a.m. So you have, as a result, we have no problem recognizing your authority, realizing that local leadership knows the community, knows their health and their capabilities and everything better than the state. We have no problem with your leadership. We have a problem with this pattern that's developing, and we don't understand. We're not at the table, apparently, with the scientists and the data people that are proving Somerville's different than every place else. With that, I've talked quite a bit, so I'll leave it. Thank you.
Well, thank you, Steve. There are several questions embedded in this, so let me try to directly answer all of them and let me know if I haven't. Let me clarify, I disagree. We actually, when you mentioned Boston has more expertise than Somerville, no, that's not the case. We are engaged with experts in epidemiology, public health, science, some of them world-renowned. And in case you let me clarify, I also chair the Metropolitan Mayors Coalition, which are 15 cities and towns in the inner core, including Boston. And along since the pandemic began, I co-chaired and facilitated larger regional coalitions, including North Shore, along with Salem Mayor Kim Driscoll, in statewide efforts. It has been, Steve, so we're clear, municipalities that have set the tone when the governor dragged their feet. When experts told us, close schools, start ramping things down on March 12th in Somerville, it was the last time we all met as leaders together. The state, including the governor, were reticent about doing that, even though every expertise and scientists were doing it. I say that because to just illustrate that we are engaged. We've had public meetings when those experts, maybe you weren't at them, have informed and gone over the data. Our incident command team, our staff is talented. Yeah, we're probably one of the municipalities, including Boston, that have an analyst embedded in the way that we do. We have an incident command structure that was developed as we thought far ahead of the pandemic and how to respond. We engage international consultants to do that. Again, I'm not saying this to be defensive. I just want to clarify, because you alluded that we're reacting slowly or don't have expertise. So the bottom line is we've tapped into expertise and expert think tanks from Northeastern, from Harvard, from Tufts, and they're engaged with us real time and consult with our data team every day to help inform our policy decisions. And when we engage and work with other municipal leaders, they rely on Somerville as one of the communities and portals of expertise. When we have major statewide coalition meetings, we bring those experts to the table. So I hope I've described fair enough way that we do rely on that. You have a valid point, and I've heard that many along. The state does this and Somerville moves, but in Somerville doesn't do it at the same time the state. I guess I would vehemently disagree that that's because we're not informed. In fact, we are very informed. If I could describe the state's approach best, especially in this last round when several municipalities attempted at least an effort at a regional approach, which is what it should be. Let's face it, if you want to knock down the pandemic or any surge, you treat it like water coming to your home. You want a tightly interlocked, consistent barrier. And because the virus is like water, it'll find a way. I'll admit that has not been the case, despite municipal leaders across the Commonwealth to a T imploring the governor to do that. And in fact, there would have been many more municipalities doing that, but because of the state's inconsistent message, and even the president at the time, where they, some select boards or other officials or members of the community say, well, they're saying it's safe and we shouldn't do it. But we've seen from the slides we've just shown you, we've suffered a lot in this resurgence since the fall. A lot of people have died and gotten sick and continue to become ill. So I'd say we've been very well informed, and we'll continue to do that. And that will drive us moving forward. I will also say this in terms of what is actually occurring. The state is pretty much described it this way, and I'll call it blood calculus. When they've ramped down or taken measures to lower capacity or certain activity, they described, and they pointed to a Northwestern University, I believe, study or report. Well, if you reduce capacity by so much, only so many people will get sick. And this will be the economic impact. The problem with that approach, and I'll go now to the worldwide reference you made, Steve. We have examples around the world. You know what they've done around the world? They have closed everything down. At the same time, they did what we asked to do. Give businesses, their employees, people, direct financial support. Don't evict people in the middle of a pandemic, right? You just don't do that. So we have those examples of what has succeeded and what has failed. But here, no, we didn't do that. What has happened? I'd submit more people have become ill and died than we could have avoided. So I get the frustration. It is a valid point. I hear from everyone. I don't have a good answer other than to say, you're right, it is Patrick. And that's exactly what it is. But I would submit to you, we will not change our approach. We are relying on expertise and data. There's an old saying, you can cheat on your spouse, you're just not going to do it with me. Okay. And because if the state doesn't want to lead, or is happy with that approach, because at the end of the day, they say we have enough capacity in our hospital system. That might be the reality, but the reality is people becoming ill and very ill and dying. And the people that are becoming ill and dying, they don't look like you and I, Steve. Okay, and I can point to them in our community. And if we want our business community to recover, then we have to have a healthy society. I'm all in. So I hope that kind of gives a context to that. We're happy to go and give you a full presentation to you and the board and every member of the business community, how we look at data from the very beginning. Then I'd ask you to compare it to other communities. I think I'd submit you'd find us doing a pretty good job and impressive. But I share your frustration. It's a valid point that there's so much inconsistency. And we've been asking for nothing more than a uniform approach to how we move forward and take on the pandemic. Thank you.
There are a few questions, so I'm going to try to categorize this a little bit. I just want to also acknowledge Councilor Kristen Strezzo is also on the line, and she had a question. I'm going to direct this to Nick Antanovica, our Director of ISD. The discussion, Nick, about how quickly inspections can be done so that businesses can reopen was a question from the councilor, and then a general question in terms of aside from providing PPE and adequate spacing for employees, are there any other requirements for office spaces?
Thank you, Sue. Yes, to answer the question regarding getting out to open up the businesses, at this point, a majority of the businesses have already submitted and have approved safety plans. There are very few out there that don't. Going back into this new phase and reopening again, basically, we're just looking at following the approved safety plans that were already submitted and received. There may be a minor adjustment due to the occupancy levels, but quite frankly, doing the spacing, most of the safety plans are already at the current occupancy levels to begin with. So we don't see an issue opening up any of the businesses, as there are maybe one or two that would remain that don't actually have safety plans to open up to at this point. For the office buildings regarding the PPE, on the Mass State site, there is a checklist of items, and it's the same items that we would look at the other businesses from a general standpoint. Yes, we have the PPE. Yes, we have the spacing. The other thing that we would look at as well is just to check the ventilation in those office buildings to make sure that you have clean vents, you've upgraded what you have there, and that you've cleaned the filters.
Thanks, Nick. The next one is really around vaccination. Doug Kress, Director of Health, is also on the line, and certainly the mayor can answer most of these as well. Will there be vaccination sites here in Somerville at any point? And if there is a need for space for vaccination distribution centers, would it be helpful if businesses offered their space during downtime?
I'll start, Doug, and then you can answer. Thank you for the suggestion. The short answer is possibly. Somerville, because we have experience and we have an emergency preparedness plan developed, and we know how to do this. A lot of municipalities have this expertise, and which is why we've stressed to the Commonwealth, use us so you can allocate your resources more efficiently to other communities who may not have even the minimal capacity that some of us do. But if we get even at a minimum, the allotment of vaccine to meet our current plans, we could vaccinate up anywhere from 500 to 1,000 people daily. Right now, our allotment is 100 per week. That is a result of national supply. Eventually, that's going to ramp up, and we want to be ready and working with regional leaders and the governor, hopefully, to have a more robust integrated plan. In terms of a regional site, because right now that's all we have. We are in conversations with our local health provider, Cambridge Health Alliance, and the safety net communities that they're servicing about what that would look like. And that'll be dependent upon, how much more vaccine supply we get. So that is evolving. There's a potential, and we do have some sites in mind where that could service. We want to make sure that we have equity, meaning have access, people, especially the most underserved parts of the community, that can get there, not just Somerville, but on a regional level as well. Doug, I'll let you finish that answer. Thanks.
Great, thank you, Mayor. I think that's great, and I agree. Thank you for that offer. And if there's a need, absolutely, that would be great. Just let us know about the spacing that you have. As a reminder, when we look at this particular vaccine, it actually is a 2-dose vaccine. And because this is a new vaccine, everybody has to be observed for at least 15 minutes. So once you do receive the vaccine, we need to have enough space to make sure that there's that observation period as well. So it does limit us at times of where we're able to administer the vaccine to do that. But absolutely, we are moving forward. We are hoping once the supply chain loosens up and that we have additional supplies that are available to us, we will have more vaccines that we're able to implement or get into people's arms as quickly as we are able. The one thing that I do want to remind everybody is that there is the criteria in the eligibility list that was identified by the state, and I believe that you saw that in one of the mayor's slides as well. We do have to follow that. That is part of the agreement. In order to be a vaccine distributor, you have to follow the eligibility criteria. So please keep an eye on that, and that's available on the state's website. Currently, we just, all of phase 1 is open now, and 75 plus, which is phase 2, group 1, are the eligible right now for the vaccine.
Thanks, Doug. Now I'm going to shift a little bit to reopening and capacity questions. There's a question regarding, can you add to the 25% capacity if, let's say, their attendees have produced a negative test or they've been vaccinated? What's our strategy for that? And then in terms of capacity increases, what's our plan moving forward? Or specifically for phase 3 businesses, do you see that going up?
I could start, and I'd ask them either Omar or Doug. Potentially going up, I would, yes, potentially, and we're gonna be deliberate and some of it diligent and rely on expertise and not react to what anyone else is doing. We'll be informed what the community is doing, and we'll make sure we do an even better job of trying to communicate with y'all, make that predictable for you. I just want to say a cautionary vote, remind everyone and clarify about the vaccine. We need to give the vaccine a chance. That means the trends of transmission, let's keep our fingers crossed, keep going down. No, even though we don't know what's going to happen with the variants. Being vaccinated, the greatest benefit, this is a big deal. I don't want to play with it. The vaccine is a scientific achievement of immense proportions being developed, that they're being developed, but it's going to protect us people against the serious impacts and effects of COVID. It's not going to stop transmission from what we know. So I think we want to give it the chance. Even though we strive to get everyone vaccinated, we're still going to have to be smart, wearing a mask, exercising proper hygiene, social distancing, and monitoring things like how much capacity. So those are the things that are going to evolve, and we're going to pay attention to, and hopefully others will as well, and other governmental jurisdictions. But I'm going to hand off to Omar to finish that up, and Doug, if you.
Omar, we can't hear you. No, we can't hear you. While we wait for that, Adrian, I do see your hand up. We'll get to your verbal question in a second.
Can you hear me now?
Yes.
Oh, okay, fantastic. Sorry
Hopefully
about
the
that.
vaccine gets off faster than your response.
I think there were two pieces to the question, a negative test, and then if someone is vaccinated, I'll address the second one. First, getting vaccinated even after the second shot and waiting the 14-day period to give it a chance to have the maximal impact it can have does not make someone infectious. We're still waiting for that data. It's an assumption. Someone can be vaccinated, not have any symptoms, but still be infectious and transmit to other folks. The second, or the first question was about having a negative test. A test is only as good or is good for that very specific moment someone gets tested, that when that sample gets collected. That's the point in time that test is analyzing. And negative test is not necessarily an indication that you're not infectious afterwards, or you may not be infected. If you wanted to run that type of operation, you'd need to test people almost every day for a certain activity, or do universal screenings, which is what we're trying to implement in the schools. I think what I'm trying to clarify is that those would not work as a basic safety protocol.
Thank you. Before I go into more reopening, Adrian has been very patient with me, so I'm going to, Adrian, you are unmuted.
Thanks, Sue. Can you hear me?
Yes.
Perfect. Thank you. Mr. Mayor, thanks so much for your time this afternoon now. I really appreciate the opportunity to have this open dialogue with you. One of the key things that you touched on, and rightly so, is that you've engaged with with a number of experts, and you review the data with your team. I'd like to echo Steve's sentiment that you have a fantastic team around you, and you regularly reviewing data points. One thing I would say as businesses that we haven't necessarily had line of sight on or transparency on is the specific metrics or data points that have been informing your decisions. We will regularly be on a call where you'll present the various different data points, but we haven't always seen where the specific data points need to get to, or what it is about the data points that is informing your decisions on whether it be moving forward with a phase or whether it be adjusting capacities. So you mentioned today that you are continuing to review the data and the experts that you have around you. We welcome the opportunity for the city to go back to phase 3. But would you and your team and the administration be prepared to share with us as businesses what the specific metrics and data points are that would allow us to, for instance, increase capacity, whether that be from 25% or above, or for those of us with more restricted capacities, at what point we might be able to increase those capacities? And if you are prepared to share those, when would we be able to engage with you on that? And what would the process look like if we wanted to increase capacities or ease some of the restrictions that have been imposed on our businesses? Thank you.
Thanks, Adrian. I'll start, and then Omar can chime in terms of now, but I don't know if Adrian, you also wrote in the chat, if someone else did, I forget who might have did it. Thank you for the question. Points of fair points. So I would say yes, happy to engage more robustly and even more transparently and love it when people want to look at data. I think it's important. We want to make sure that whether you agree with us or not, that at least you know what is, fueling our policy decisions, and we can have a probative discussion about that. So yes, and what I would say, and after Omar answers, or just before he does, I'm just thinking out loud, and perhaps what we can do is I'm happy to arrange, I don't know when the time would be, we could figure that out sooner rather than later, and having a conversation where we actually just have a data conversation, and we'll bring whatever experts are available who work with us regularly to talk about that and have a conversation on that. So that's my general response. I'm happy to do that. Omar, did you want to add to that?
Yes, thank you, Mayor. I wanted to point to the link I just posted to all the attendees, to the link to our city dashboard. It has a pretty significant number of metrics and graphs that explain the current situation and shows it back in time. To address the specific question about what type of data we look for, the 3 main drivers or 3 main indicators, then the rest just allows you to form a context or draw a picture for it, is the daily caseload. So that's a rate per 100,000, and it allows you to compare it to all cities and towns. And we do an average, a moving average over 14 days to standardize it, to normalize it. Then the positivity rate, and then we make sure that we keep an eye on the number of tests that we administered for our residents. If it declines too quickly, that is extremely problematic. Where we are today is before where we were on Thanksgiving. We are at an extremely high baseline. A normal baseline would be 10 cases per 100,000 or less. So that gives you an idea of how different of a context we're in right now in this surge. What we're in right now is also coming off a peak. We haven't decreased significantly. It's not safe, and it would still need to go down. And that is done by having restrictions, being safe about the way those health measures are applied, and the way people comply with them. But to the mayor's point, I'd be more than happy to participate in a data conversation anytime.
Yeah, if I could just finish, Adrian, and others, if that's of interest to you, shout it out in the chat. We'll do that. We can bring, put all the metrics up and cheat up, give you advance, and just share the data with you and have a conversation, what's the data mean, why, and so forth. We would love to do that. I just want to add an answer to another thing in the chat. It's related to this. And again, excuse me, I just forgot the name. It was in my mind. Someone said, what evidence or metrics, what do we have on analysis to show that any of the measures we took to close or roll back were impactful recently, such as closing certain activities, not going the same capacity levels as the state allowed. Well, that's to be determined. And I think that could be part of that conversation. One of the things, experts advise us is to avoid any risk of a super spreader activity or where a super spreader can originate from. And that drives policy decisions as well. There's going to be sort of a post-game analysis, I'm sure, at some point, and we'll be able to know better, and it'll show us a lesson. So for that question and many others, we are happy to do that even sooner rather than later. I think it's a great conversation to have, and we'll be excited to engage all of you on that.
We're going to shift a little bit to reopening questions regarding past phase 3. So when do we anticipate entertainment venues such as movie theaters, bowling alleys to reopen? These larger scaled venues being closed are having quite the impact on the smaller scaled mom and pop operators without the traffic being driven. And does the reopening indoor recreation bowling in this case depend on vaccine distribution? Is there a timeline in which we anticipate those to be opened?
Sorry, Omar, did you want to, and others, you want to start that answer?
Yes. So this is a really difficult, so like you mentioned, Mayor, we're in a situation where it feels like activities are getting pitted against each other. So those larger venues have always been described and have been shown to be higher risk venues from a health standpoint. In order for us to get to some kind of normalcy on the school district side and get a number of our kids into an in-person learning situation, we need to have a low baseline. So if we don't see that baseline realized and don't have the ability to reopen our schools properly, I wouldn't be in a position to make a recommendation to go towards those types of venues and for a normal reopening. And we can have the detailed conversation about how and why and what the timing would be. It would all be informed by that data that I just described a couple of minutes ago.
If I could supplement and add to that, going back, thank you for that question. And what Adrian brought up is that, I think it'll be really good. That's why I'd like to do and propose to do that meeting with the experts and all the data sooner rather than later, because those are great questions to put in that context. And perhaps I'd submit when we all look at the data at the same time, real time, and hear each other's sort of probative questions, and we understand how the city makes a decision, it might generate more questions or understanding, at least a context of how those decisions can be made, and perhaps give some predictability to some extent, if that makes sense.
There are a few there's a curfew question. What's the current state of curfews in Somerville? Is there an update on when restaurants can open past the 9:30 p.m. Requirement?
So I can answer that question,
ahead.
Mr. Mayor. So the order that went into effect yesterday on Monday, February 1st, moves the city towards kind of the same situation that the regional or the region is at, especially our neighbors. As of Monday, there is no 9:30 curfew. The governor removed that and we followed suit, I think 2 weeks later. Restaurants are able to operate under their current license or approved license by the Licensing Commission. I think their last decision was to move certain 2 a.m.s to 1 a.m. Outdoor dining is pegged to 11:30, which is the where we were before the mid-December rollback. Is that clear?
Yes, thanks, Omar.
If I could point out one last thing. In an indoor dining situation, we deem it to be dining, not just drinking. Bars are not allowed. That activity is probably the most dangerous activity that anybody could be engaging in. It's maskless and it's with alcoholic beverages. So I wanted to make sure that people understood that food is also the important component that goes with that ability to reopen at that time.
Thanks, Omar. We have a question. Does the 25% capacity apply to a private business or solely public-facing businesses?
The way we understand the governor's order is it's across the board. And their language is unless something very specific to that activity or that industry is laid out somewhere by DPH or another entity, not that we know of. So it's across the board, 25%.
And with that, I hope I was able to translate most of the questions that came through. Tom Bent is on the line and has been waiting patiently. Tom, I'm going to unmute you. Go ahead, Tom.
Okay. Thanks, Sue. Thanks, Mr. Mayor, Omar, and all the other staff that I know are behind the scenes on this. Just to kind of, kind of kicking back to Steve's question, one of the frustrations that we're hearing from, and me as government affairs chair from, members is, it's been the confusion of seeing, the state do one thing and then the delay on when it happens in Somerville. And I know for a while, I know you were working very hard and you were successful to a degree of trying to build a coalition, especially cities and towns around us, in the inner core, so that, you'd be in more of that regional type of approach than just, where the governor might say, yeah, this is what we're doing, but maybe not looking at, well, where the hotspots are and things like that. And it seemed like with this last decision being made as far as rolling back, the hours of operations and things like that, or taking those restrictions off, there was confusion out there from the business community. I think we got some mixed messages from the city. So that's a lot of the that created a lot of angst across the business community over the last couple of weeks, and I think that's where I think some of that could be avoided. Having maybe more often having these type of conversations. And more back and forth maybe between the business community and the administration. And one of the things, and I was glad to hear about talking, that people are very, want to be involved with more about the conversation about the data. But one of the other things that I was wondering about is having a conversation with people that are open right now, they might be at 25%. You have restaurants, you have businesses, you have construction. And because there hasn't been a lot of feedback as to, hey, how's that been going? How's your restaurant been dealing with the issues? What issues have been coming up? How are the patrons handling all these things? I think we're hearing one-way dialogue. It might be good to have that dialogue going back and forth so that the administration and everyone working on this gets a better idea of what's going on the ground too, And the questions that we get asked, whether it's my 100 employees that are over, 20 or 30 jobs in the greater Boston area, we're dealing with restrictions and things that Somerville may have one, Cambridge has something else, Boston has something else. It's enough to make you crazy, And again, I hear you when you said a more regional approach would be, you would just think that this would be the way it would be. So I just want you to understand where that frustration's been coming from. And I think we all do appreciate all the work that you have done and your staff. I know Omar gets tired of hearing from you, I'm sure. All these businesses are under a tremendous amount of pressure also, not only, financial pressure, but pressure from their own employees. They just want to be able to know, there was a lot of confusion when the governor, cut back the restrictions on the hours. A lot of businesses just thought, hey, I'm back in business. On that weekend, I saw on Facebook, maybe a half a dozen Somerville restaurants saying, hey, we're back up again on Monday until 11:30 at night. They just didn't understand that the city still had that regulation in. And their employees are calling them saying, hey, does that mean I can come back to work? So that, just so you understand, when Steve's question came out, he's handling a lot of that, and we're trying to balance all that and try to get the information out to everybody. So I think, working together is really, like you said earlier, is the only way we're going to get through this.
Yeah, so thanks, Tom. I'm going to answer that, but I saw Jessica Eshelman's going to have a question. So we're going to take it live because I came on a few minutes late, so I owe the group several more minutes here. So we'll take that live after this. So Tom, thank you for that. First, let me answer saying I want to assure everyone we have not given up on the regional stuff. I promise you that. We've not thrown in the towel. And I do want to be candid and honest and ethical in my responses that where things are. First, before I go any further in the answer, let me say, if you all or any one of you believe that government has failed you, no matter what level, you have a right and valid point there because it has collectively. If you feel frustrated because you think we're doing things, you have a valid point if we're doing things last minute and that we're not in sync with the governor, because none of us are, because they make announcements. We typically find out nowadays when they have a press conference. So whether it was the vaccination rollout, every municipal leader in health, local board of health found out on that Wednesday. Whether it was the reopening of or loosening up a restriction, same thing. But I want to make sure I clarify. Myself and every other municipal and regional leader is engaged with the administration and asking them at a minimal for communication in real time and no surprises. Because while they're making the decision, we are looking at our data, understanding we're going to make some changes and go back to 3.1 as an example, and like to be in sync. Because obviously, one of the things we're concerned about is it'd be natural for anyone to be confused. Does that mean I can do all that? What some of them are going to do? And then we do it later, and it looks like the right hand doesn't know what the left hand's doing, and much of that is actually exactly true. That is my point of frustration, but I don't want, we're not dejected. I will tell you, we are in coordination with other municipalities, and it's up to us, and it's our responsibility to continue to engage administration, say we need to tighten this up, much like you're doing with any of us. You're letting us know we want to discuss this real time. If there's something we can know in advance on level to make better, we want to do with you, and we want to do that as well. So I will say, everything you're feeling and angry and frustrated about is absolutely valid. You don't need me to validate that. I will say I recognize that. We're aware of that. And we will do everything we have to do here in Somerville to make sure we try to lessen that frustration, to communicate better than what you're getting overall, to engage and be transparent. I do want to be honest and ethical that our approach may not, in most cases, may cause confusion because we are going to be deliberate and diligent and methodical. Many municipalities don't even have the capacity. We don't have a lot of it. We have enough and pretty good capacity to do the type of work that we do and making our policy decisions, which is why we've been from day one. If there's any good thing or positive comes out of this, I'll tell you at the governmental level, it's an even greater recognition of the need for regional collaboration. So I'll say that, but I do agree with you, Tom, and what everyone is saying, whether it's Adrian's point, we talked about data, not on that. I believe more frequent meetings now, especially since we hope vaccine's going to get out and things may get better, and we have to, one way or the other, we'll know the impact of the variants heading into warm weather. What do we do? And I put this in this context also in terms of a sense of urgency. On the economy, we are very fortunate here that all the work we've done together and as a community in terms of for investment purposes is paying off. It is rapid in terms of the amount of investment in life sciences, biotech, to bring the, as the chamber would say, the upper story daytime population we need to support our small businesses. However, we need to make sure all of you are going to be around, or those who want to launch can start that new idea, which is why I stated and emphasized the need to think about what that looks like in the future. So as we head into these next few months, hopefully with a positive direction, having that real-time conversation about not just reopening and how we're going to make those decisions. Okay, we may not be certain, at least I know what the city's thinking. I'm not confused by any decision the governor makes or anyone else makes. We can tighten that up, but to begin that work in parallel to that. So I know it's a long-winded answer, but I do want to recognize, however you're feeling, if you're pissed off, you're frustrated, you have more than a valid point. You're spot on. You should be, because I am also, but we're not going to stop working. We're going to try to continue to right that shift from where we sit, even as one municipality. And we're going to stand side by side with you to get you to the other side of this thing. So thank you, Tom, for that point.
And with that, I think we'll take our last caller, Jessica Eshelman from Union Square Main Streets.
Thank you so much for hosting today and for your leadership leading us through this incredibly difficult time. I agree, you've noted so many challenges around inconsistency and predictability when it comes to this virus and so many things that are related. However, one thing that feels like it can be controlled is communication. And I hear from so many business leaders who are confused themselves, as Tom just noted, their employees are confused. And I'll add one third audience, which is the public, customers and others, aren't sure where to get information or where to look for the most relevant and timely information. And Mayor, you noted that this is anger and frustration, but I'm hearing from business owners directly where this is impacting mental health, which takes this to a whole nother level. It's fantastic to hear about an engagement opportunity around data conversations. Union Square Main Streets has been very eager to engage in those as expressed since last fall. But I really needed to take this opportunity to highlight in terms of the announcement communication that businesses just don't know where to look, how to look, to stay on top of information, and are really challenged by sometimes receiving hours of notice for something new going in place, or in some cases, such as the curfew, receiving contradictory information from the licensing commission in the morning, and then later that evening from city staff through the licensing commission. And it's just very important that I hit on that, because again, so much we can't control, but communication certainly feels like it's something we could and should.
Thanks, Jessica. Fair point, and I'm hearing that, and whether it's you just stating it now pretty clearly or others who've reached out or chatting about it. So yeah, I hope the data conversation is really good. I'm excited to do that. I don't want to limit us to that, and I don't want, and in that meeting, let's just keep that meeting that, but I believe and I'd submit we should capitalize on the work we were doing together around reopening to include the areas that there are gaps in, it appears, and if they are, we're going to fix them. We need to do it right now around communication, all the things and concerns you're bringing to our attention now or highlighting. And I don't want to wait weeks on this. Let's get going on it. Let's see what we can, things we can control. You're absolutely right. We should hit out of the park. So we're committed to doing that. Following this meeting, we'll reach back out. Sue and Tom and the team, we'll set those conversations up. And again, we'll set the data meeting up separately, but in addition to that, parallel to that, about communications and other things that have arisen that may be gaps here locally that we can control.
And thank you very much, everyone, for joining. I believe that is the last of the questions. I do have a question from Zach in regards to communication, and I think Jessica just brought that up as well. We'll follow up with that. We do understand that we need to update our Novel coronavirus business website. We'll certainly do that this week as well. So you should have up-to-date information on that.
Yeah, and if I could just say, thanks, Sue, for facilitating. Chamber, Steve, Tom, and everyone in Main Streets for being on here, and all of you. We're gonna get through it together. And what we do well, we're gonna try to do better. Where we need to improve, we're committed to get that going. And where we need to engage more, we will do it. We hear you. We recognize and aware of the many challenges you have because you've been reaching out to us. If you didn't get your questions answered now, if you think of something later, please get back to us, reach out ASAP. We will follow up on the next steps here. And we appreciate you just being in this community and the investment you made. We know how critical small businesses are for Somerville. It's the DNA, it's the very fabric that attracts all the major investment that's coming here, wants to come here to be part of this community. And I want you to know we're well aware of that, and we're gonna do everything we can do. Not help you get through this, but make sure you survive and grow, and let others in the community have the opportunity to chase that. So thank you very much for joining us, and I look forward to engaging really soon in all those conversations, and we'll make that happen right away.
Thank you, everyone. I'll use the attendees registration to send you guys out the slide deck that we had for today. This meeting was recorded, so if you would like a recording of that, please email us at economicdevelopment@somervilleMA.gov, and we will certainly email you with other follow-up from this meeting as well. Thank you again for joining.